Hello YouTube, my name is Claire and I'm here to describe what happens in an STA MCA bypass in layman's terms. This is of course assuming every doctor is a little bit different, every person's situation is a little bit different, so what they do. But in general, here's what happens, and I had this done 11 weeks ago. So first of all, diagnosis of an aneurysm. There's two major types. It's a little diagram, two major types. There's a kind where the blood vessel itself just expands, that's called fusiform. And then there's a kind where you get a little bubble right where blood vessels dissect. In this case, I had a fusiform, and the location of it is rarer, the size of it was rarer. So I was at risk for stroke, even if it didn't burst. When you have this kind of fusiform, the blood can still flow through, so it's at less risk for bursting in general. However, there's still consequences. Blood flow doesn't flow as easily. It's like in a river rapid. It makes a little hiccup and you get a little backflow, so it's still not operating so smoothly. So here's what they do in an actual bypass surgery. There's different kind of cuts depending on the location. I had a T-cut, which goes from right here back to the back of my head, still tender. Not much nerve sensation though, the nerves were all cut. And then the other cut comes from up here down in front of my ear. It's like two pizza slices that they could peel back. Here you go. I'm losing hair either from the surgery itself or from the radiation from 3 angiograms. An angiogram is a high-powered x-ray with contrast. They send the contrast up through your legs. It's not a camera. I was watching a Sharon Stone video and she said it's a camera. It's not a camera, it's contrast. So the contrast is put in through your femoral artery, basically right in the pelvis, in your thigh, bikini area. And you're awake. It's not bad at all. You might see the actual contrast like lightning. I saw it. Other than that, no big deal at all. So then they send it up through one side of your neck and then they release the contrast at different times to get different pictures of your brain. It's actually very beautiful pictures. Okay, so that's an angiogram. The actual bypass. So they cut open the skin, and out of the skin they actually remove an artery, one that they think looks good. It's got the same kind of blood flow. They already in general know how much blood flow goes through different kinds of arteries. There's 3 different kinds. There's like minimal blood flow, medium blood flow, and lots of blood flow, depending on the size. So they choose the right size for what you need. Now they don't know for sure that they're going to do a bypass when they first go in. They might just actually cut out the aneurysm and bring the blood vessel together if it has enough slack that it can do that. They're not going to put too much tension on it. My case, they decided to go ahead and do the bypass. So then they cut out a huge chunk of skull. Again, depends on what you need done. Could be a very small chunk of skull. I had 2 different opinions on that. Remove the skull. Go in, fix the aneurysm. In my case, they put 1 clip in. Then they bring out the new artery. They attach it to the other side of the aneurysm. Oops, sorry, I did a bad little drawing here. Okay, so blood is flowing this way. They put a clip in to stop blood flow. Now right here they need to attach the new artery that they took out of my skin. So here it comes. And now there's new blood flow. In some cases they might just clip the aneurysm and not worry about sending new blood. I still had quite a lot of blood going through, so they needed to keep on sending blood to all those blood vessels. So where is this blood coming from now? They don't attach it to here because the way your blood vessels are shaped are like a bowl. They come up through your neck and they go like this. So it's not direct little lines. And because of that, even though this may only be a few millimeters apart, this is much deeper in the brain for this STA MCA bypass. So instead, they're going to run this all the way from my ear. So they connected the artery behind the aneurysm right here, and this new blood vessel is connected to the external carotid artery that comes up in front of the ear. So now, normally your blood vessel is way deep in your neck and comes up through the middle base of your skull and out like this. They've completely changed my blood flow for this one artery. It's now coming up through my external carotid, which would supply blood vessels on the outside of my head. And they're taking some blood, and they left a hole in my skull and sent the blood vessel through that hole, and that's now where it's getting blood. Now, your skull does grow back together. Well, I've got a hole in it. How's that blood going to keep on going? Because they make that hole just big enough that it won't heal itself, just for that one little hole. And that is essentially the STA MCA bypass in layman's terms.